Hello, everyone, and welcome to another episode of The Everyday Leader. I am your host, Dr. Ananya, back with another amazing guest, my good friend, my old colleague. By old, I didn't mean neither one of us is old. No, that's not what I'm saying. But my previous colleague, my brother in ortho, Frey Almeseged. I'm so excited to have him here. Um, Frey, welcome to The Everyday Leader, man.
Thank you. It's always a pleasure to see you again. And after many years of residency together, we are on this platform, so I'm happy to be here.
Yes, great. It's great to see you. So I know who you are. We know each other, but for those of the audience who don't know you, who is Dr. Frey Alamseged? Are you going by Mister now or Doctor? Because I know you're in the
Uh,
UK. So.
yeah, so I'm going by Mr. now.
Okay, so who, Mr. Frey Alamseged, and what inspired you to pursue a career in orthopedics? And how did you get to where you are right now? So just give us the gist of it.
Okay, so now I'm going by Mr. and I had to learn about that on the first day. So they were giving me a badge for work, and I'm like, "What's your name?" Dr. Farah Hadera. And they're like, "What department are you in?" "Spinal surgery." "Oh, you're a surgeon." "Yeah." "Then you're a Mister." I'm like, "Wait, all those years of hard work just I've worked so
With
hard to get
Mr.
the title, and yeah, it went away like that. But yeah, I mean, there is a long history behind it, but surgeons in the UK are called Mr. So I'm going now by Mr. Farah Hadara because we have to use a surname here. So I'm currently a senior spinal fellow in Southampton. um, so orthopedic by training. Went to Tukuran Hospital for my medical school as well as for my postgraduate studies. And then I've done a spinal fellowship in Nottingham, and currently I'm a senior spinal fellow at Southampton.
Mm.
And for the second question, why did I choose orthopedics? Um, I think it's a mix of things. One, I've always been inclined to engineering in general. So, like all of my friends in high school thought I was going to do engineering. And my physics teacher was really surprised, like,
Go.
so orthopedic surgery, I've always been inclined to engineering, and even my physics teacher in high school. So I went to Saint Joseph School. He was really surprised that I joined medicine because everybody thought I was going to join engineering because that was kind of my attitude and my mindset. So in a way, it was a way of coming back to it after going through medical school. And then the other, I think, particular event was when I was a medical student. When I attached orthopedics, just something about it got me ticked, and I was just hooked. And then I was very keen on listening about, back then, uh, young residents like Sami were presenting about hip hemiarthroplasty, and I'm like, I've never heard of it before. So I was like this is the kind of thing. So I was just inspired right there and then. And then I think at the end of my training in medical school, I talked to Azi, by the way. So they were the young guys that I used to look up to. So I talked, like, I already knew that I wanted to do spine surgery. And then I talked about going through neurosurgery or going through orthopedics, but I knew I wanted to do spines. So I think I like the challenge. I like the mechanics part of the subject, and I think, like they say, I'm very outcome oriented, and orthopedics has a very good outcome. So I think those are the main reasons.
Yeah, that's great. I love how you mentioned that. Sometimes we think people who inspire us are big names, but usually it's actually people right next to us, like friends, colleagues, that other residents, right, senior residents, and somebody still in the process of becoming something. It's not the actual, the very senior consultant with like 50, 100 publications. It's not really that person. It's really the guy or the gal right next to you. So there's inspiration everywhere. I love that you mentioned that. Um, so from Gurambasa, which is Black Lion Hospital, to University Hospital of Southampton, that's an extraordinary path and not a common one, right? Not the typical one that we hear. So, what were the key steps and milestones that led you to, a spine fellowship in the UK, um, and for aspiring surgeons in Ethiopia and in Africa as a whole, because the two systems are different? What practical advice would you offer to help them, um, to prepare for a similar trajectory?
I would say I think knowing what you want to do is the key thing. So I remember one of the consultants around the time we were finishing medical school said, when you finish a training, that's not like the end of the journey, that's the time to take off. So like you should already envisage where you're going. And then I wouldn't say that I knew the exact trajectory until it happened, but I was very determined that I should end up being a spine surgeon with good, excellent training. Like, so like you said, inspirations don't come from far, and it's not necessarily the big achievements or the success stories. It's about attitude, like aspiring for excellence. So when you see like young doctors who are opening like new paths, like starting new services, starting doing new procedures, which have not been attempted before, you go like, okay, so these are people like getting to new horizons. So you go like, there's no limit. And I mean, it's unfortunate because we come obviously from a less privileged state of technology, economy. So things that have been already being done in other countries, they are coming to our country about, I don't know, 50, 100 years later. And but that breakthroughs those colleagues were um, making kind of created, what, this area has not been explored as much. And it was my strong feeling that we need to have fellowship trained spine surgeons in Ethiopia, where it's not like, being creative or trying to compromise and create your own uh, tools and things like that, which would end up undermining the quality of the service. So when you set the bar high for yourself and what you expect and you think your patients deserve, then it also sets your own expectation higher. So you have to be a safe surgeon because health should be safe wherever it is, be it in a first world. The demands of health are the same. Every patient wants a safe surgery, um, needs a dignity, needs it to be pain free. Um, so you can't accept a different outcome just because of your situation. Um, and young people like Sami, Azarias, and I remember Zaga, Ebenezer. So these were the kind of people that I was looking up when I was in medical school. So I talked to Azarias back then. I told him like I want to do spine surgery. Of course, he would advise me to go through neurosurgery because he was in neurosurgery. But I had this, like I was drawn into orthopedics for some reasons I sometimes can't even explain. So um, the determination and the inspiration, the first thing. But the key things I would say was having finished orthopedic training, one, or it can be a neurosurgery training. So the spine surgery, you can come from both specialties. Second thing was, I will get into it later, like what the different options are. But what really happened for me was, um, I got a job offer, a fellowship offer from the UK, from an institution which would sponsor my license. And I had to take the IELTS exam with minimum requirement of 7.5 passing score. And having done the COSEXA, orthopedic surgery helped as well. And then you have to just validate your medical degree, which is not hard to do. And then I've been involved in spine campaigns. Like at any opportunity I got to be involved in spines, I've tried to push myself into that. So I think I would say get involved earlier, take the necessary exams, be involved, and then now there are many options, be it by getting a job offer, or you can just do the direct license pathway.
I love that. Because, I think it's very important to share the journey. It is great to celebrate the achievement, but sharing the journey is really what makes the difference, because you're you're equipping whoever else wants to take that path, and feels like, oh, I don't know what to do because no, I don't know anybody who's gone through that. But you sharing this step by step of how you got to where you've gotten to, I think is very fantastic, and I want to applaud you for that. And I love that you mentioned that you've always had this clear goal as to where you're going. Because people are different, right? Some people are more of explorers. Like as they progress in life, they just kind of find out about what they want. And some people are just specialists, and they're just set on one thing and they achieve and go for that specific goal they've set. So you have to know your personality and what works for you. You have discovered that early on in your career, and obviously it worked out great, because you are successful where you are right now. um, I wonder, what was there at any point a thought like this might not happen? Because it's very easy to think, oh, I'm trained in a system that is completely different from this system that I want to go into, and my qualifications may not be enough. And I'm just saying the quiet part out loud, because this is the thought at everybody's, at the back of their mind. They have this thought. So has there been any moments like that, and what has helped you explore them and still try it despite having those concerns?
Yeah, so unfortunately, every training, at least they would expect you to have some baseline knowledge, some baseline exposure, and whoever has had that exposure has the advantage ahead of you. So if me and somebody, let's say from India or from Canada or from the US, if they had had some spine surgeon who's mentored them, if they have assisted in such surgeries, then they would have the lead on me. By the time we apply, obviously I'm not going to be an ideal candidate. And as you might know, especially around my time, it was very early days of spine surgery in Ethiopia. So unless you go to specific surgeons in specific centers with lots of lack of resources and implants, it's very, really, really like a narrow corridor of opportunity to see any spine surgery. So that kind of keeps you, like it's going to be very competitive job to get into. And trying to make up for that, the only options that I had were attending these spine campaigns, which are usually done by overseas doctors who come here for 2 or 3 weeks. And it's funny because before I saw any discectomy, before I saw any single level like burst fracture fixation, I was seeing big scoliosis correction surgeries. And it was a privilege, but those were my only opportunities to get my hands on anything related to spines. Um, so there would be times where you like, how am I going to make it through and get that competitive edge that would help me secure the job? But I think I was trying to push through many opportunities. Like um, I did some international exams, um, you know, in my head because I thought that would give me more options. And by the time I had the UK, I also the UK fellowship offer. I also had another one from Canada. So I was trying to get like one way or the other. I have to do this final fellowship training, and I think, partly lucky, but luck comes when you're really trying to put yourself out there. So I think getting yourself out there is very important. Like you can't just sit there and hope for things to happen. You have to get yourself involved in areas where that will likely lead you to where you want to go. Um, and I especially have to thank Mr. Magdum Zagai, who is a consultant spine surgeon in Nottingham, and Mr. Wei Yun, who's also a consultant spine surgeon in Nottingham, and my department in Tukurambasa were very cooperative. Anything that was asked from the department, especially Professor Brook, was very instrumental in facilitating me getting the spinal fellowship. So I was lucky in that way, and also the Cure team, because they hosted this spine course, and those are the platforms where you get to know people who can kind of help you and throw you a lifeline, if I may say, that might get you on the boat. Um, so yes, there will always be a challenge, but it's, I think, the determination, the effort, and the bit of luck. So just like our athlete Haile Gebrselassie says, you know, you can do it. It is possible, as long as you really, really want it. And I'm a Christian by faith, and as long as you have faith and you put your effort on, I think sooner or later, somehow it will happen.
Yeah, that's very I love that because you're right. It's really, at first I love that you mentioned faith because that is very central. And for me, everybody that I've spoken to that have achieved many great things have faith at the center of their journey. So that's very important, and I don't think we need to be shy about saying that part out loud. And also people. Um, it's very easy to be shy and stay in your comfort zone and what if my English is not good enough? Okay, if I don't speak, nobody's going to judge me for that. But at a cost of what? Sometimes just going to someone and introducing yourself and just saying, my name is this is what I do. And people think, and I want to hear your take on this, but people think they have to be interesting to meet people. But it's the opposite. From my experience, you have to be interested in the people to meet people. That's like the only way you establish relationship is to know that the other person is way more interesting, has so much more to offer than you. So that takes off the pressure on you having to be or present yourself in a certain way. Wouldn't you agree?
Yeah, completely. Because some people think, I think it's a bit of our culture to be a bit timid, as if being humble and quiet is, I mean, true humility is always good, but you have to be outspoken. And um, unless you're there to present yourself, like if you see leadership, it's people who thought they deserve it that end up being the leaders, not the smartest person. It's not the most wealthiest or experienced person that ends up becoming the leader. It's just the person who thought he can do it or she can do it. Those are the people who come to front. It's not like the most qualified, very analytic, intelligent people that end up being the leaders.
Yeah.
So sometimes you go like, if you're going to complain about why things are, being directed this way or that way, well, they took the initiative to lead, and here you are, being the receiver of the consequence of these decisions. So sometimes if you think you have a better idea, then you might also need the guts and the determination. You know what? Instead of being passive about it, you be proactive, present yourself, get yourself out there, and then try to play a more leading role than waiting and being a victim of somebody else's decision or leadership.
100%, 100%. Couldn't have said it better. Okay, let's go back on track because you were saying so many good things. I couldn't pass on the opportunity to talk about those things. So, what has been the most challenging aspect of transitioning into a new healthcare environment, both professionally and personally? Because cultural contexts are very interwoven into healthcare delivery as well. So, talk to me about that.
Yeah, so I think the most difficult time for me was the first 1 or 2 months. So when you think of a training, you thinking that somebody's going to mentor you and have some intense didactic time before you get on to work. And where I started working is a tertiary center, a catchment area of a referral for spine care for about 4 million population. So it's a very busy center. And then after a week, you're just rolled in your own call. So you're in charge of making decisions, taking referrals, seeing patients, looking at MRIs, having to come up with a plan. So it was really intense. And my training back home did not prepare me at all for this. Like we had barely the basic understanding, basic information, more of academic than actual experience. So it was too much, too quick, and a bit overwhelming initially. So yeah, there were times like, and I know of some people who like just quit after a month or two of getting that opportunity. Some people dropped down, like some people went for a different route. So it's not easy. So as one of the surgeons says, it's not like for the lighthearted. Like you really need to be a person who can stand such intense environment. So that was, I think, by far the challenging part. The cultural part. So I had this very funny incident. So, and like I look back at this and just smile now, but now when I see it, it's just very juvenile. So I went down to the emergency because I was called to evaluate a patient. And then because it's a very busy center, sometimes patients are just put on a trolley in the middle of the corridor. And once I was there, like I was there with a patient who was on a trolley in the middle of nowhere. And then I asked, like, what am I going to examine this patient? And then one of the nurses told me, yeah, you can push the trolley into one of the rooms and you can examine in there. I'm like, why am I pushing trolleys now? Like, like I had that sense of entitlement. I'm like, I'm not doing this. And then because I was not really aware of the culture and the kind of environment I was really in. And I remember like one of the consultants was looking from far and she was so pissed. And she came like, you're going to have to push the cart yourself and then examine the patient. No, I'm not going to do that. And then, yes, you are. And then she started, like the consultant, I'm a fellow. So the consultant herself started pushing the trolley. And I'm like, oh, I think I might have missed some cultural cues here. So after that, I asked my fellows, like, do you guys ever go to the emergency and have to push it trolleys yourself and then examine the patient? I'm like, oh yeah. So there was some this lack of awareness and the cultural difference that I had to quickly catch up to. But I think it's a very good system, like the UK system. In general, there is a very good culture, like of courtesy, um, good manners. Um, of course, you have to be very observant in the slightest cues and pick up on things like nobody is going to point out there for you unless you kind of read the room. So I think I've learned this reading the room and picking up on slight social cues and things like that. Um, but more importantly, I think the professional challenge was by far the hardest thing that I had to pass. But there was a good support system. Usually, the colleagues next to you would show you things, and then you kind of see the pattern, the algorithms of the decision-making process. And after a couple of months, I kind of adapted to it, and after that, I started even enjoying the work. But these were the initial hurdles I had to pass.
That's so funny. That's just hilarious. I imagined myself being you in that moment.
Yeah, like if I saw myself there, I'm like
That's funny.
doing that. It's funny now, but at the moment, I thought I never had to do that back home. Like, well, yeah. But I think yeah, those are the things that you look back and laugh, but also you have to learn from. Yeah.
Yeah, yeah, that's the thing. I think a lot of people, it's very exciting to think, oh, I'm gonna go. First of all, it's a Western country, right? So I'm gonna go to this country and do my fellowship or whatever sort of training I'm gonna do. And you don't really think about the realistic part of things, the actual reality on ground. And nobody tells you that. So,
Yeah.
like you said, you just get thrown into it. And Nottingham, right? That's where you were
Yeah,
first.
Nottingham was the first 2 years of my fellowship. Yeah.
Man, I remember when I visited that hospital, I was overwhelmed. Like, my jaw dropped. I was like, wait, what? Because there's like a helicopter pad, and when you walk in, it has like everything is kind of underground, right? Like the first level is like when you walk in, it's like at certain level of the building you walk in. It's
Yeah.
not the first floor per se. Yeah, so I was like, and then there was like radiology intervention room on this side. This side is this. I was like, everything was there and available.
Yeah.
Everybody knew what they were doing, and everything was fast. It was like,
Yeah. Like they just call it the big machine. It's just many patients come in, go out, and the flow is very intense. And it's hard. It also very multiple specialized centers with a lot of multidisciplinary team working together. So I think yeah, I think lucky and privileged to have been trained. It's also one of the AO centers of excellence for spinal surgery. So it's intense, but it was also a very good place to have your training in.
I love it. I There are certain things that stand up that stood out to me that day. The first was Wayne when yeah, Magdam's colleague, the one you referred to. He
Yeah,
so I was in Leicester, so we had to drive from Leicester to Nottingham, and he had to come pick me up. And he drives a nice car. The surgeons drive nice cars. The
yeah.
spice.
One of the reasons we work we do what we do is
Is for the
putting
cars.
other good outcome. Yeah,
It's for the toys. I
it
believe
is
you.
for the toys, intraoperative and outside the theater slot. Yeah,
I know. Men and the toys. Anyway, he's driving this car. I don't remember what it was, but it was fast. So on our way to Nottingham, I felt like I was flying. It was not a drive. And he was talking, right? He got his hands on the wheel and turning and looking at me to talk to me. I'm like,
keep your
please
eyes
keep.
on the windshield, please.
And I thought that was gonna be the highlight of the day. And when I got to the hospital, I was like, what? So it was. I loved every experience of it, and even inside, there were things that I saw. I was like, oh my god, like how do they do it like this? But also, I love that you mentioned, because you came from a different healthcare system. There are probably Indians. I see a lot of Indian
Yeah,
physicians in the UK, a lot of other Asian countries, Pakistani and things like that,
yes,
Africans as well. Um, but what you see is the system is built in a way that is so resilient, so independent. Whoever you are and wherever you come from, you will fit into it. Like the system will mold you to be effective, efficient, and skilled in it. Versus when you come to our healthcare system, like back home and most African countries, I would dare to say, you're the one who molds the system because there is no system.
yeah, yeah.
It's almost non-existent.
Yeah, so I mean, that's one of the things is when there is a very much established system, no matter what your background, it's just you will come to a leveling ground where you have to fit into the system. Otherwise, it's going to be a lot of bumps at some point. You're either going to fit in and go with the flow, or you're going to be just out of the system. So the mix of fellows that come there, it's like from different backgrounds. Some of my colleagues like had 10 years experience in spine surgery. Some of them have done some previous spinal fellowships. And there are some people just like me who are doing their spinal fellowship for the first time. And some even less exposure than I've had. So it's like a spectrum of people, but you go into the same tube, and how organized it is, how comprehensive it is what impressed me the most. Like the level of care. So one of the great things about the training place that I went to is it had all pediatric spine, like scoliosis deformity corrections, adult deformity corrections, and then the common tumor infection trauma. So all kind of spectrum of pathologies are treated there. And whenever you're handling these complex cases, you have to work with other teams like the intensive care, the pediatrics, the nutritionist, the microbiologist. Um, so it's a very good functioning machine that, like you said, no matter what kind of person you were, you come out at the end of the system being on a better platform, ready to work in the same function. So, but like you said, in back home, everything depends on you. Like you create the system. If you just turn your face away, then things are going to fall apart. So it's like uh, very much specific person driven system, which is unfortunate. But I think eventually we have to aim to establish a system where no matter, I like the famous quote saying, leadership is what happens when you're not there. So we should have a system where the system kind of runs by itself without relying on specific individuals. And I think that's what we need to aspire to have eventually back home.
100%. Um, so let's just stay on that topic. So, what do you see as the core strengths and limitations of the system that you're in currently and the system you came from?
I think the core strengths here with the NHS, it's a public funded, it's a very good system which looks after its own people. So it's very comprehensive to the point once you operate on the patient, all the demands of the patients are taken into consideration. So the basic things that you ask are like their housing condition, who do they live with, that their house have a stairs, is the toilet seat too low? Like, can they get out of the toilet? Like things you never thought you would ask or are relevant to what you have done. If they need any specific neuro rehabilitations. So there is a group of teams looking after one individual comprehensively. You do your surgical part of things. If it's antibiotics, there's a microbiology team to look after that. Like you don't even deal or even choose the antibiotics for your patients. And then after that, the occupational therapist would assess their potential needs that needs to be addressed. once they are discharged out of the hospital, the physiotherapist will look after them. If it's a pediatric team, maybe you need a discussion with a geneticist or a nutrition expert, what to do. So you see this all-rounded aspect of care for the patients. So I think that's a core strength that I've observed in the UK health system. And the efficiency of the emergency system actually is life-saving. So I know of a patient, it's a bit of a sad story, but had what would have been a life-ending event. So he had a fall while he was in a stadium. It was like an occipital-cervical dissociation, and then he had a cardiac arrest at the scene, and then he was resuscitated at the scene, and then picked up by helicopter, brought to a hospital, and was in intensive care. So he survived. He was conscious. He could communicate, but unfortunately, because of the injury, he had like a tetraplegia. So these are like theoretically unsurvivable injuries. So now they have reached to the point where they can make such patients survive. Unfortunately, it's a very precarious situation, even if you're alive, to live with that kind of lifestyle. But what I'm trying to say is, even things that were not survivable are being survived because of how efficient the system is. So their emergency system is very good as well. So I think this would be the core strengths. The weakness, I would say, because of high demand and it's publicly funded. So for minor, or not minor, but minor for the, in terms of doctor's perspective, but it might be a big deal for the patient. If you're not in a dire or in an urgent situation, then getting elective operations takes very long time. There's a bit of inefficiency. That would be, I think, the weakness here. And back home, the strengths, I would say, is you get to do very hands-on procedures early on. So as a relatively junior resident, you still get to have some independent operation. That might be a disadvantage in one aspect, but in terms of getting early exposure and hands-on experience, I think we have those advantages. And we have a young population. Again, unfortunate for the population, but because of high road traffic accidents, things like that, your level of exposure to complex fractures and things like that are very high in Ethiopia. So in that aspect, you get to see more exposure and more surgical experience. The weakness, I mean, it's going to be a long list, and some of it is just really disheartening. One of the reasons and the stories I have is, while I was an orthopedic resident, I was on call covering for emergencies, and I had a 20-something years old young woman. I remember the story vividly. So their house was being taken down, and then she went in to pick up something, and the wall ended up landing on her back, and she had a spinal cord injury. And she had some mild limb trauma, which I think was splinter or something. And then at the time, we had to discuss with the neurosurgical service what to do about her spine injury. And the response was, at that time, we didn't have any spine instrument and implants. And then she had to be sent, and she was, I have to add this, she was a second trimester pregnant. And I asked them, so what am I going to do with the patient? Like just catheter and then some education or about catheter care, and then just send her home. I'm like, really? That's it? So I remember that experience. I'm like, we have to be better than this. We have to be better than this. So we basically sent a young second trimester pregnant lady with spinal cord injury home with just a catheter. So that was one of my like really low moments of my residency where I like, we can't accept this. So something has to change. I don't know. I'm hoping things are better now, I think, but yeah. So the logistics, the training, the organization is what we need to do. I know there are some movements with the spine. They're trying to open some spine centers with Habit Hospital, I think under St. Paul, and some movements in the private sector as well. But I long to see an organized, dedicated spine center looking after our public.
Mm. So, I mean, obviously, such stories need to be, first of all, they shouldn't exist, right?
Yeah,
From the get go. But if they do, unfortunately, and they do, they should be the last ones.
yeah,
Nobody else should be exposed to something like this. No patient has to go through this, no physician has to experience this. So let's break it down. And we obviously need to elevate the level of care to what you now see in the NHS. So, what would it take structurally, educationally, or systematically to get there? And I know you might not have all the answers, but from your point of view, break it down for me and tell me what can we do to get to that level.
I think I see two approach to this. One is like top to bottom and maybe bottom to top approach. Um, some things like, if in your working area, like your desktop and your desk is a bit dusty, you can't blame but the owner of that office space, right? So it's you. So there are things that we can do that we should do. Uh, but in the grand scheme of things, it's a high demanding service. So some things have to come down from top to bottom, right? So in general, like health public policy that gives this a big attention would definitely make a difference. Like I see there are more electric cars in Addis Ababa than I see in the UK. So you can see how much a policy can affect what really happens on the ground. So I think a proper attention to trauma, orthopedic, and specifically in my case, spine care should be in place. And then you can collaborate with partners and mobilize. I think there are a good number of, not good or ideal, but at least better than what it was, fellowship trained spine surgeons in Addis Ababa now, like some of my colleagues, and I'm sure they're trying their best. So I think they should be empowered, they should be supported, and trying to establish a dedicated spine center. Of course, initially from the public health aspect of things would be the first step. And once you have that attention, then the drivers, until a system is established, of course, it will be on the spine surgeons to lead the way of establishing these services. So I think both from the doctor's point of view as well as from the big policy makers, they have to meet in between and make this a reality, I think.
Yeah, 100%. What's your take? Because orthopedics is a very um, tech dependent and tech driven field.
Yeah,
Um, and spine surgery is no different, if not even more.
yeah,
Um, so how do we level that out? Because there's financial constraints. We haven't even achieved like the basic level of care, and then the world is progressing 10x when it comes to advancements. Where do we even begin? I'm just curious. We're just brainstorming here because none of us have the answer, but I just want to hear your perspective.
yeah. I think it's not going to be an easy undertaking, and unfortunately, just like you outlined, spine surgery is not a cheap area of industry. Um, what happens here in the UK big industries, like back home, like we buy implants and then we buy also the instrument, the kits. Here, there's no such concepts. The industries just lend the instruments, and the institutions, the hospitals, just pay for the consumable implants. And then there is a big partnership between this, the trust or the hospital and the industries, where the industries have to sponsor education, training, and the rest of it. So for us back home, I think we can start with those providers which are relatively affordable, like there are reasonable, good quality Chinese and Indian implants where patients can afford without compromising on the quality of implants and longevity of these implants to do the job. But also it has to be comprehensive. You can't compromise quality, especially when it comes to things like spine surgery. The infection prevention should be high because the consequences are really significant for the patient, also for the doctors. So I think that level of mentality of maintaining a standard, maintaining an excellence, always aspiring for a good standard of care should be the defining principle. I think the teaching hospitals probably should take the lead in establishing such services because they're likely the ones who are linked with other industries, with other international partners. I know in Black Lion they have this, on Thursdays they have spinal surgery services where the orthopedic and the neurosurgery spine team are trying to work together. I hope we expand more on that. But I think at least we have the personnel on the ground now. I think there are some promising starts. We just need to expand on that, and kind of we need to branch out ourselves and get more support to get the service, the infrastructure, and also awareness. What I sometimes in our country, patients are very reluctant to undergo spinal surgery. Maybe they have a good reason at the moment, but sometimes it's life saving, sometimes it's function saving, sometimes it's quality of life saving. But people, unless they are very desperate, they would never resort to spinal surgery just because there is this apprehension about its possible complication. So I think we have to break through that apprehension by showing good outcomes, and public awareness as well as policymaker awareness is, I think, something that we need to work and advocate. And I think such platforms of interviewing and creating what's awareness of what's possible is, I think, one of the inputs that we can contribute towards too.
Yeah, 100%. And when you work in a system with such constrained resources, sometimes you get so overwhelmed. We've all been there. You have worked in a rural hospital. I've worked in a rural hospital. Even if they're teaching centers and stuff like that, they're still very underfunded, under-equipped, under human resource training is still lagging far behind and things like that. So, you know, think of the surgeon or think of yourself back then when you were in that rural hospital, probably by yourself. It's
Yeah.
not uncommon to have just one orthopedic surgeon in a hospital in Ethiopia. So it can be very overwhelming. So, what would you say? What would the role of the orthopedic surgeon be, whether they're in the capital city, in a relatively equipped tertiary hospital, referral hospital, or a teaching hospital, or they're in some rural hospital? What would be their role?
I think it's two faceted. One is the clinical responsibility, and second is the leadership responsibility. So, I mean, you can't build everything by yourself, but also you don't have to undermine saying, I can only do so much and give up altogether. because I know the work you've done in Gondar University with the Leicester team. So, you were very instrumental as an individual and in enabling and giving access on starting a service that was not there. Um, and yes, it asks too much of a person. Um, so when I went to the district general hospital, where I served briefly after finishing my orthopedic training, uh, there was no orthopedic service in that area, and trying to get implants and trying to get support from those relatively better institutions, nobody would support me. Like I said, if you give me some of the implants, I'm trained, I can decrease the referrals to you. Just give me some basic things that I can start with. Nobody was lending hand. And then eventually the administration within the general hospital was very supportive, and we managed to purchase some orthopedic sets, and we started fixing with some rationales, plates and screws, X fix, and so we started a bit of basic orthopedic service. And it's one of the things I take pride in uh, as an individual, because it was like literally zero, and at least we got it to some level. And after I left, in that place, in that hospital, there were some orthopedic surgeons which were being hired, which didn't exist before. So I'm hoping they've taken on, and that service is continuing. And the people around there at least know that there is an option. So I will never underestimate what a person can do. Like, individual efforts definitely make a big difference, and we don't have to be bogged down and just give up, saying it's a big mountain that we can't uh, go against, and then sit with our hands tied. We have to do what we can, and just when you try to do something, then some people will partner up with you and then um, help you make a difference. So I say, as individuals, we have to keep our efforts in, and also look for supporting teams. And I would say, just never give up, try to push boundaries, and try to make a difference, small or big.
Yeah, 100%. And it's so funny you mentioned that you asked for help from another bigger institution that's like very closer to geographically close to where you were. But the thing is, they're also scrapping for resources. That's also the other part, right? It's like, yes, they're way better off than you, but they are far from having enough as well. So it's just so much going on. But I think the one thing we need to be honest with the coming generation of surgeons is that nobody told us that this was a reality. Nobody told me that this was a reality. When I graduated, it was it was more like, oh, do your fellowship, okay, and then go work somewhere till you get to do your fellowship. That's not an advice. That's a recipe for disaster, because it doesn't prepare you for anything. Like, there's no detail, it's just a blank statement. So, and then you go and you see all these things, and it's very, like you said, it's very easy to say, what am I doing? Like, no, I'm just gonna do the only thing I need to do, which is see patients. And if the equipment is there, I'll do some surgeries, and then I'll just go do my fellowship. And but we have to be realistic, and we also have to. The one thing that is extremely underappreciated and undervalued is leadership skills as surgeon. For whatever reason, surgeons have big egos, and just because we're a surgeon, we think we're good at everything. No, you might be great at spine surgery, but it doesn't mean you're going to be a good leader. One has nothing to do with the other. Leadership is also another skill, right? You might be a great arthroplasty joint replacement surgeon, world renowned and stuff like that. Doesn't make you a good leader. So, um, we need to teach people that those skills are important, because I've seen too many times people look at you do something and they're like, that's easy. You know, it's always easy to just sit and criticize. Ah, that's easy. So when establishing a department, or like you said, getting equipment to this hospital that had nothing, that's just, I could do it. Yeah. Until you actually try to do it and you realize it's not that simple.
Yeah, yeah,
Because you have to think about budget. As a surgeon, you don't need to think about a budget, right? Unless you go into leadership.
yeah,
Then you have to think about teams. It's not just about me getting trained. Now my nurses have to get trained, because when I go to the OR, I need to work with somebody who understand what the equipment is, how to use it. Um, and I need my anesthesiologist to be at the same level of awareness and training. Okay. And then I need the people who clean to understand that this is not, you're opening a very sterile part of the body sometimes. And you need to make sure that the level of cleanliness is more important than, let's say, where you do a theater where you do just emergency debridement or laparotomy and things like that. And then when you talk about budget, people are used to buying gloves and, fluid, resuscitation, fluid for resuscitation and stuff like that, which are relatively cheap, versus orthopedic equipment, which is relatively expensive. And then there's the education part, because you cannot bring about long-term change without integrating education, whether it's for your for the surgeons, the trainees, establishing a department and having a specialty training, for your nurses, for your physiotherapists. Bruh, like, sometimes it's so easy to sit down and criticize people and just say, oh, I could have done the same thing. No.
yeah,
When you're in it, it's a completely different story. And that's really why I think we need to teach people how to be a leader, because I see a lot of people who appreciate people who have advanced, whether it's publication wise or on clinical side of things, and underappreciate people who actually carry the burden of carrying the departments and carrying the institutions to the future. So I think we need to prepare the next generation in that sense as well, not just do fellowship, become a professor. All those things are great, but we also need people to take bigger responsibilities, because we need to make sure this is sustainable, right?
yeah.
Um,
I think, yeah, I mean, we're in a way lucky because when we were trained, we had good leader role models who were, like Professor Brooke and or like other consultants like Sami Galatau, where you can see they're influencing and shifting paradigms and starting new services, new fellowships. So that was also part of my inspiration, saying, okay, these young doctors are making so much difference, so I can also make such a difference. But like you said, it's easy when it's happening as if it has happened without much effort, but there is a lot of work that goes behind it. And these soft skills of leadership, um, and generally being motivated and having that drive to make a difference, it's a big deal. And you can't do much just because you have the knife in your hand. Somebody needs to put that knife in your hand. Somebody needs to bring that glove into the room. Somebody needs to set up that room. And especially with spines, like I said, you need a spine surgeon. You need a neuro monitoring specialist. You need a good anesthetist. You need a good ICU care. Um, you need a good scrub nurse. You need a good implant available. You need a good transfusion blood bank system, uh, because if one of these links fall, the whole system will collapse. So it's a lot of teamwork, and you can't have that by just being technically efficient. And somebody has to do that leadership role efficiently as well. Yeah. So I agree with what you said.
Yeah, it's crazy. Really, when you think about it, it's like um I love and I'm all for, yes, go do this fellowship somewhere and come back, and then you're like, and it's also a recipe for disaster, because now you know better, because
Yeah,
you've seen a functional system,
yeah, yeah.
and now you come back and there is nothing. And then, if you don't have those skills, if you're not taught those skills, if you're not mentored with those skills, you're gonna face a huge challenge of the burden of job dissatisfaction,
True.
and you're going to be depressed. And because we have to be realistic, right? As a doctor, you're already a responsible person, because that's the business of being a doctor, trying to take care
Yeah,
of, or a healthcare professional trying to take care of others. So when you fail to do that, but now you're more skilled and you've seen even more, it's just a recipe for disaster. So I think that systematic thinking, that holistic approach to things, would be a much better approach to things.
yeah. I think it's not just a matter of expectation as well, but the first principle is do no harm. And if you don't have these proper facilities,
Yeah,
you might actually do harm
that's right.
to your patients and do a disservice than a service to them. So it's not being demanding or being spoiled, asking for these things.
Mm-mm.
It's asking for basic safety and standard of care. Um, I know sometimes it's disheartening when you go back and you just go,
Mm.
what can you do? Uh, but again, just like the pursuit of specific fellowships we've longer and managed to get, if you put as much determination and motivation and with the right team getting together, I'm hopeful it will happen at some point. Uh, but yeah, I think it's going to need that person with unwavering determination and passion to lead and to establish a system um, at some point, and hopefully it will become a reality at some point. Really,
Yeah, yeah, I really hope so. I mean, there's always, I see a bright future, to be honest. There's so many young, motivated people, but sometimes, um, motivation has to be directed, because you can have motivation that can be hijacked by the wrong things as well. So we also need to think about those things. Thank you so much for, I mean, it's always great talking to you, on or off camera. You've been one of, you're my junior. You're younger than me. I'm not that old though. But but it's always been inspiring, and I think there's a lot of good things that you mentioned and you pointed out in this conversation. And I hope whoever is listening to this at whatever stage of their career, would take those important life lessons. And I know and I believe it's going to help a lot of people. So thank you for coming on, and thank you for
yeah,
this conversation.
yeah. Thank you for having me on this platform to have the um, platform to share and uh, give the younger and aspirant doctors the possible pathways. And I would say, if you're determined, if you really want it, you can make it happen. And the opportunities are there, much more achievable than we think. So we just have to try to get them. And if anybody wants specific advices, I'm also happy to help in any way I can. And thank you for having me as well.